All right, good afternoon, everyone, and welcome to this restaurant industry informational session presented by the Wyoming Business Council and the Wyoming Lodging and Restaurant Association. I'm Warren Appella, the Agency Services Manager for the Business Council. I'll be your facilitator today. Let's cover a few quick housekeeping matters, and then I'll turn things over to Josh to introduce our panelists. Written questions may be submitted using the Q&A function on the webinar toolbar. We will respond to these as time allows, but we are going to give priority to the questions submitted in advance. Please do not submit questions via the webinar chat box. These may get missed. Panelists, please keep your microphone muted at all times when you are not speaking. Keep background noise to a minimum also. This is, of course, the neighborly thing to do for everyone participating today, but will also help us ensure we've got good audio in our recording. And yes, this webinar is being recorded. It will be made available on our website, wyomingbusiness.org, and on the WBC YouTube channel as soon as possible. With that, I will hand you off to Wyoming Business Council Chief Executive Officer Josh Durrell, and he will get us underway today.
Thanks, Warren, and thank you all for joining. It looks like we've got about 100 folks now attending, which is fantastic. Excellent to see so much interest. I know this one was definitely had a lot of interest from not just the folks who are owning restaurants and making sure that their businesses bridge the gap here, but also by, I know the public wants to get out and begin frequenting those establishments for sure. So very happy to be putting this on today. I know this one is going to have a lot of questions, and so we're going to spend as much time as possible on questions and answers. As Warren mentioned, many of those have already been submitted, and do those through the questions and answers rather than the chat. If you can, that makes it a lot easier for us to manage that and triage that as well. As Warren mentioned, my name is Josh Durrell, and I'm the CEO of the Business Council. But really today, the stars of the show are on the next slide. The experts that we brought in are really going to be extremely helpful and make sure that your questions are answered as best as we can. We have Stephanie Pyle, who's a senior administrator in the Public Health Division of the Wyoming Department of Health, and Stephanie has done a great job in previous webinars with other businesses, helping them understand the logic behind the health orders, as well as ways to make sure that we're complying on those. And then Chris Brown, who is the executive director of the Wyoming Lodging and Restaurant Association, who is just a tremendous resource to be able to bring some best practices to bear on the webinar and make sure that our restaurants are operating efficiently, safely, and again, you know, our goal with this is to make sure that we balance those the health of our communities, as well as the economic health of our communities, and make sure that people are working as efficient as possible. As we, before we get into the real stars of the show, I do want to talk about a couple items, if we might. It has to do with making sure that your businesses are promoted as much as possible throughout this. And so you'll see on your screen a slide where there's a website at wideopenwyo.org. And this is an area where you want to make sure that your business is listed. At the top right of that screen, you'll see a way to list your business and make sure that it's up to date. And I don't need to be the one to tell you that promoting your site through Google and making sure the new hours and service levels are up to date on Google, as well as your social media channels. You're the experts there. You know how to do that, but really making sure that you're communicating with your patrons and with the public about what is available, what special precautions you might be asking them to take, and just making sure that they know you're open for business and ready to take orders. So that's a real key component. The other thing that I do want to mention before we jump to the next slide is that, you know, while in some ways you are competing with the restaurant down the street, most of the time I would say that it can be a little bit competitive, but let's be honest, right now it's all about making sure that we're collaborating and learning from best practices and thinking about the restaurants and bars as a community as a whole. And so thinking about how you can collaborate with with who might be your competitors in another time to really try to figure out ways to comply, to do this thing creatively, and to make sure you're taking care of your customers and making them feel comfortable. I think it's a real key time to reach out to your community members and work together there. As a way of helping out a little bit with some of the new guidelines that are being put out, we do have a little bit of information on our website, and there are various state agencies who are putting out some pretty creative things to make sure that people are paying attention to social distancing and making sure that we're putting some signage out there. So there are some resources available at that website there to be able to utilize and maybe make it a little bit more fun if you can. And then with that, we're going to turn it over to Stephanie Pyle, who is going to go through a couple of things. One is the health metrics that we look at and make decisions based on that data, as well as the changes that will be coming forth statewide on the 15th or tomorrow. So with that, Stephanie, thank you for joining. Appreciate your time.
Hi, everyone. Good afternoon. Thank you so much for being on the call. As we all know, this is a challenging time for everyone. And what we're trying to do at the Department of Health is everything we can to protect public health, and yet understanding the balance that needs to be struck in terms of economic health. So we have been working on this, and truly we have staff members who are working on this night and day. I just finished going out to our public health lab this afternoon and seeing the work that they're doing on behalf of all of our counties in terms of testing and turning things around as quickly as they can. So it truly is an all hands on deck kind of scenario right now. And as you may have heard and seen, some of the metrics that we're looking at in terms of monitoring our situation in Wyoming, we are always looking at the metrics that are available up on the screen right now. So we're looking at new cases, the number of new cases that we're seeing each day. We're seeing, looking at % of cases attributed to community spread. And so this means how many cases are we seeing that are, we can't tell the origination of the outbreak or of the case. And so we are keeping a constant eye on this. Sometimes we know if a case, if an individual is positive due to travel or due to contact with someone who is positive for COVID-19. And so these are the cases that are most concerning when it's attributed to community spread, because we really can't determine where that case originated from. As you'll see on this metric, this measure is stabilizing, meaning that the rate of cases that are attributed to community spread is on a slight decline. And so we're pleased to see that. With our new cases, unfortunately, we are still seeing new cases each day. And so we're definitely keeping an eye on that. We would like to see that metric turn the other direction. % of all tests that are positive. So we have done a large number of tests in our state, and we do many at our public health lab, as well as physicians and providers can use other commercial labs, as well as some hospitals have the ability to do some testing on their own. And so what we really want to see is that % of all tests that are positive. We want to keep a close eye on that to make sure that we're not moving in the wrong direction. Currently, about 4% of all of our testing that we're doing are positive. So we want to keep a close eye on that and make sure that that number is staying exactly how we want it. Total COVID-19 admissions reported by hospitals. As you can imagine, and as you've seen across the country and across the world, quite frankly, the hospital capacity is a very important area that we need to monitor, because our healthcare systems can easily be overwhelmed. And obviously that's what we really want to avoid. And so we're keeping a close eye on this at all times, making sure that our hospitals have the resources that they need, and that they're not, getting to a situation where they may not have the capacity to continue to help the people that really need the most help. So these 3 metrics here that you see on your screen have to do with really keeping a close eye on that: admissions, hospital bed availability, and ICU bed availability. And the other thing we need to keep in mind is that people need healthcare for other reasons too, not just COVID-19. And so we need to just keep a close eye on this to make sure that our system is able and ready to respond to all the needs of our community, whether it's COVID-19 patients, or others. So these are really important factors that we're monitoring. We look at other factors as well, but these are the key ones that we like to mention and monitor and talk to counties about on a daily basis. We send the county information out on a daily basis so that the county health officers and other local officials can be very aware of this on a minute by minute basis to the greatest extent that we can. Can we advance to the next slide?
Yeah, we'll go ahead and jump to that. We might be experiencing, there we go.
All right, so as most of you probably heard on yesterday's press conference, we are making some changes that will go into effect on Friday. So the goal here, as we're constantly working on monitoring the metrics, is to be able to return to some semblance of normal. We know that this is not something that's going to happen overnight, and we know that we have to ease our way into, easing the restrictions. And the reason that's so important is because we don't want to do something that would cause us to move in the wrong direction and cause all of those metrics to turn red and to really be going in a way that we don't want to see. And so we are, as you've heard the governor talk and Dr. Harris speak about this, we're taking small measured steps, each step of the way so that we can try to balance out, where we have to take the important public health precautions with the economics of our lives and I know of your livelihoods. And so these are the restrictions that will be eased as we move forward. So you'll see a summary of the order that we put out with regard to tables and how many individuals can be sitting at tables, the spacing of those tables, signage at entrances, reminding people not to come in if they're ill, reminding people to keep that 6-foot distance, the requirements for restaurant staff in terms of how they provide service to the customers there, disinfecting guidelines, staff washing hands between guest interactions, the use of hand sanitizer and gloves, and how surfaces should be cleaned throughout the day at the business. And, businesses maintaining a record of staff hours by date and time. And certainly that's something you're already doing in the course of operating your business. And then no playgrounds should open that are at the restaurant, as well as no self-serve or buffet, and no dart, pool leagues, dances, karaoke, or events like that. So that is a summary of the order changes that will be effective through May 31st. And one of the things that's been helpful when we're on these webinars is when we understand the questions that are coming in from the individuals and the businesses that these orders impact, we're able to develop guidance to help answer some of the questions that are out there. And so that's been a very informative part of the process of having webinars with different types of businesses, is we know how to provide that additional guidance that might be useful to go with the order once they're issued, so that we can get that out and be as helpful as we possibly can.
Stephanie, before we jump from this slide, we do have a couple questions I think might be best. I know we've got the question and answers at the end, but they might be okay to cover right now because they deal directly with some of these particular guidelines. Can you talk a little bit about what the counter or bar seating might be like as it relates to a table, or is it just 6 feet between patrons? How does that work?
Right, so that's a good question. So what we are envisioning is that it would be 6 feet between patrons, unless of course they're in the same household. So I suppose if you had, and keeping in mind that it's hard for us to envision every scenario that might come up. But if we had a household and the members of the household were sitting at a bar, then there would need to be 6 feet of space between that household group and the next set of patrons that were sitting at the bar as well. So that's how we envision that actually happening in practice.
Okay. And I do have another question, and then I think Chris has a couple that he's gathered from you. Is hand washing between bringing food to table sufficient if the employee is more than diligent about washing his or her hands? Changing gloves every time seems very wasteful.
Right. So thank you for that question. I did see that in advance. And so, what we're not trying to create is a scenario that just is not practical in terms of carrying it out. But balancing that out with the need for sanitizing or handling those items with clean hands. So in practice, people could be sanitizing in between each, and I think it just becomes a matter of which is more practical, changing gloves each time or sanitizing their hands each time. And so either one would be sufficient because it does achieve the same goal, when it's all said and done. So that is an option. And if that's something that would be helpful for us to put out in guidance, we certainly can.
Okay. Thanks. Chris, do you want to ask a couple and then we'll see if there's some other ones that come in real quick?
Yeah, that'd be great, Josh and Stephanie. Thank you so much. Stephanie, does this new health order supersede now the county variances that are in place? Is this now the playing field that the state works on? And if counties would like a variance, they then would apply for a new one to this?
So these orders, once they take effect, they do supersede the county variances that are in effect. And so when you think about these variances, when we granted variances last week, and we did that for about 21 counties, the variances that we granted largely had this exact language in the variances. So they're, basically we're now as a state moving to where all but 2 of the counties were in terms of operating their restaurants. So it does supersede that, but it should, for the most part, be less restrictive or the same as what the counties had based on the variances that they requested and received. Now, some counties requested variances that were more restrictive. So for example, some counties requested a variance just for outdoor dining. And, I think that was one of the earlier variances that came in. And so that was the request, is for outdoor dining. So for example, this statewide order would replace that variance, and it's now more broad that it can be indoor, outdoor, and a little more open. So yes, these do supersede the countywide variances that are out there, but they should be either as flexible or more flexible as what was there.
Great, thank you. And one other question, Stephanie. When we talk about dedicated staff must wait to clear table and sanitize items and surfaces after guests leave, does that mean that there is one person on staff or several, if it's a really busy restaurant, several dedicated people on staff that are just focused on clearing, bussing, and sanitized tables? You're saying wait staff and folks that would typically pre-bus and things like that are no longer permitted to do that under this order, and there needs to be a dedicated team focused on that.
So that is what we envisioned, as a dedicated team. Now, we don't want to take things to the extreme absurdity, but what we were envisioning is one set of staff that are dedicated to the cleaning and sanitizing process, and then another that's focused on serving. So, that is what we envisioned, but we don't want that to be on the brink of absurdity. So if that's not something that's practical, then please help us understand the limitations so that we could perhaps provide some guidance on this that would help, meet the public health need while also understanding the operational needs.
Yeah, I think that is workable. I think the bus staff or whoever would typically be assisting in that, it would just shift to make sure that they're the ones focused on getting that done versus wait staff pre-busing as they go and then also serving food. I appreciate the clarification. We can move forward, Josh. Thank you.
Yeah, and a couple other questions that I think are relevant to this portion and we should probably do before we jump into Chris's portion. Stephanie, when it comes to contact tracing, should restaurants get guest information, like times and names for all of their guests and keep logs of that?
We really did talk through that and kind of considered that. If that's something that a restaurant would like to do, that could certainly be helpful in the event that we have a situation where there is a COVID-19 positive individual If we get to that point where we are then going back to the different establishments, perhaps where where that individual may have been, a log of that nature would be very helpful. Sometimes, we have to go to other means if something like that isn't available in terms of reaching out to people. And so if a business is willing to do that, I do think it would be very helpful in the contact tracing process.
So it's not required, but it could be very helpful.
Correct.
Okay. Let's do this. Let's talk through Chris's portion about some of the best practices and go through. Chris has an extensive experience with not just the restaurants here in this state, but also looking at a national level at what some things are going on there, and then we'll open it back up to questions after that.
Thanks, Josh, and thanks, Stephanie. I appreciate it. I really appreciate the Business Council and the Department of Health for putting this together. As Josh said at the beginning of the webinar, my name is Chris Brown, and I'm very fortunate to be the director of the Wyoming Lodging and Restaurant Association. And having worked in restaurants for more than 20 years, I know how difficult this has been. The vast majority of restaurants are small businesses that run on a very thin profit margin under normal circumstances, and no one anticipated this. And I know that everybody's been doing their best to endure and now adapt to what the new normal is as it unfolds in front of us. And I think the number one message I want to get across today is that we need to do more than just abide by these orders. We need to own them. Our customers want to feel confident coming into our establishments that they'll enjoy the same great food, service that they've always received, but in a safe new environment. And we have to get this right. The very last thing anybody wants is a resurgence of this disease that leads to us having to take steps backwards at any time in the future, especially during the busy summer months. Our organization has worked very closely with our national partners, the National Restaurant Association, the American Hotel and Lodging Association, and U.S. Travel to stay on top of best practices that have been utilized around the country. And I just want to share a few of them with you today outside of what the new health order is. The first is, of course, continue to maintain a healthy work environment. And that is in addition to the cleaning and sanitization that we just outlined in the new order. Ensure that adequate air circulation is happening in your building. Continue to promote high hygiene standards and have adequate levels of hand sanitizer, sanitizing, cleaning supplies on hand. And please make sure to remind your employees to report any signs of illness to a manager immediately. I think it's really important to stay informed about government and industry activity and planning. I mean, it's critical to stay on top of the latest state and if there are county-wide orders affecting your business and community. The orders that we're discussing today run until May 31st. How will the next set of orders impact your business? Don't just read the headlines or scan the latest orders. Know them inside and out and execute them to the highest standards. I think it's really, really critical to communicate openly and proactively with your employees. It's so important to educate your workforce about the pandemic and what you're doing to create a safe work environment for both the staff and the customers. It's certainly a best practice to evaluate your sick leave and family leave policies and communicate with your staff what you're going to expect during this pandemic. Make sure that your employee communication system is fully up to date so you can reach them quickly and as needed as well. And educate employees about any new state or county-wide orders affecting their responsibilities as well. So like this new order, for example, your staff should know crystal clear what the expectations are when you open up. Educating employees about any of these new orders and how it affects their responsibilities, making sure that they're well educated in exactly what your expectations are and what procedures that you're following will create employees that are confident when they're serving their guests. And I really think that that's absolutely critical. It's a good idea to build in training redundancy to prepare for inevitable absenteeism. Our industry is an incredibly labor-intensive industry. It takes a lot of people to successfully run a restaurant. Start now planning ahead to account for staff illness, childcare needs at home, etc. All of us that have run a restaurant or worked in a restaurant know that folks not showing up for various reasons and running shorthanded are commonplace things that happen under normal circumstances. Plan now with a contingency plan to make sure your staff is prepared, to make sure you're adequately staffed. I think it's also really critical to maintain an open and proactive dialogue with the local community that you operate in. If you keep an up-to-date contact list with local officials that are making decisions that are impactful to your business, it's a huge step, and it's a critical one. Reach out to them, make sure that they understand that the steps that the steps you're taking to ensure compliance of the state, or if there are some local orders. I think it's a great best practice to communicate through signage, advertising, etc., the safety precautions that you're following, again, to ensure customer confidence. Whenever possible, of course, use technology to assist in minimizing contact with your guests. I know that for some, this is kind of an intimidating bullet point, and frankly, there are a lot of folks' budgets that just can't accommodate this right now, but to the greatest extent possible, make technology your friend. Contactless payment systems, automated ordering systems, mobile ordering apps, website updates that include advanced ordering, advanced payments, advanced wait list or call ahead seating options, and even simple text can really help you to communicate and conduct business with a reduced need for close contact with the public. You know, our intention with this webinar has really been to review the new state health orders and make sure you understand them clearly. It's exciting that we get to kind of reinvigorate our industry and start to slowly roll back open. We really wanted to make sure to provide some best practices to you and help you operate and answer, you know, your questions. And I know that we have a lot of questions already lined up in the queue. So I want to leave you all with this. Wyoming's restaurants and dine-in establishments have always been held to a very high cleanliness standard. And it is our time right now to build off of that existing foundation. We got to take these orders seriously. We need to lead by confidently demonstrating to our neighbors, residents from around the state, guests from around the country, and frankly from around the world, that Wyoming's hospitality industry is the shining example of how businesses can move forward and prosper during these unprecedented times. We're fortunate that the orders have been relaxed. I want to underscore again that nobody wants to see this resurge during the busy season. Let's take this seriously. Let's do a really great job with it. Let's build confident staffs, and let's build confidence in the guests that we're welcoming back into our restaurants so they know that they can safely come in and dine, you know, and enjoy the same great experience that they've been enjoying. And so the Wyoming Lodging and Restaurant Association will have a much more comprehensive best practices list posted up on our website, probably on Monday. You can see that at www.wlra.org. Anybody can reach out to me with direct questions at any time at Chris, C-H-R-I-S, at wlra.org. But as I mentioned before, we wanted to make sure to leave time. We have a lot of questions. And so Josh, I would turn it back to you, and I'm happy to answer through those.
Yeah, thanks, Chris, and thanks, Stephanie. We do have a number of questions that have come in. I think those are really wise words, and I think that taking the opportunity to make sure that we are really a shining example of how restaurants should act and looking for those opportunities to be above the board as much as possible is great. So thanks, Chris, for that. And then we do have a number of questions. Some really, you know, again, this is a challenge. And I got to say, you know, when Chris and we started a few weeks ago talking with restaurants about what kinds of things could we do to open them up and trying to understand what would be practical. And then working with health, you know, we came up with some ways to do that. And with this, of course, when you're making general rules like this, it's really pretty tough to think of all of the scenarios. And we've got some really good scenarios that I think are going to hit the mark and really help people operate effectively. So Stephanie, you're going to have your, you're going to be pretty busy here in the next few minutes, and we definitely appreciate your time. So we'll go through and ask a few of these questions and see if we can't get some answers for everyone. The first one is near and dear to many people's hearts about filling growlers. So our brewery is allowed to fill customers' growlers again. We were told we could only fill new ones previously.
Right. So great question. And I'll have to apologize for not being very familiar with a growler, but I do understand that it's a refillable beer bottle. Is that correct?
That's correct.
My lack of beer drinking experience is showing right now. Okay. So I believe that this would be covered under paragraph 1M. Drink refills are not allowed in the same containers. So unfortunately, I do not think that those refills are permitted at this time.
Okay, we did answer the question about restaurants and bars needing to keep a record of patrons. So that one is covered, and the answer was no, you're not required to do so. It may be a best practice, but you're not required to do so. Let's see. There's a question about masks and maybe some differences here, Stephanie, that you could help with. So one of the questions that came up was around masks in restaurants, but not in other retail or business situations. And also with drink refills in restaurants versus like convenience stores. And so could you touch on, those things seem similar to me. Could you touch on those?
Sure. So as far as the face coverings go, for the businesses that we have specifically addressed in orders, we have stated that face coverings should be part of the protocol for reopening. In addition to that, we've also stated that when individuals cannot maintain the 6 feet of social distancing and they're in community settings or public settings, that they should wear face coverings. So, the fact that we didn't call out every single possible business that might be happening right now or that might be conducting business doesn't mean that we're indicating that they should not wear a face covering. What's really important right now is to have face coverings when we're out in public and when we're in situations where we might be coming into close contact with others. And so we are in fact encouraging that, and we do think that that's useful in order for especially individuals who are asymptomatic and could potentially be causing transmission without even knowing it. Those face coverings can really make a big difference in us keeping our numbers moving in the right direction. So that is where we're at with the face coverings. And Josh, what was the other? The drink refills, right?
Yes, the drink refills.
Right. So as far as drink refills are going, I have personally been in a couple of places where the drink refills are not allowed in convenience stores. And in fact, that on those self-serve machines, that the store clerks are having to get those. Now, of course, I've been in probably one convenience store, 3 times over the past 8 weeks. And so it's not as though I've been in every place in Wyoming to see what's happening, but it seems that from my experience, that was what was happening in that particular convenience store. And so of course I'm not aware, if other things are happening in other, communities or convenience stores. And I do think that some convenience stores have reached out to their county health officers to get some direction on this. And I also think that some of the larger companies are getting corporate guidance on how to do this. So we believe in this order that it's important to not have drink refills and to follow this. But again, we didn't write orders covering every spectrum of every business that might be going on.
Yeah, good. A couple more questions here that have come in. One, it says, in my coffee shop, there are a couple couches. Should we have those taped off for now?
So I think as far as that one goes, and trust me when I say I would love to be sitting in a coffee shop and relaxing, just like everyone else. This is a situation where the 6 feet of social distancing should still be taking place. And also remembering that the sanitizing, the cleaning and disinfecting that needs to be going on should also be taking place on any of those common areas where people might be waiting. So I think this is probably a discretionary thing in terms of looking at the space and is it feasible for individuals to be in this space and still, 6 feet apart? Or would that look like maybe it's one person or one household could be there at a time? And so as an owner considers this, what they might find is that practically speaking, it's easier to not have those items in use. But I would say it's not that they're prohibited from being in use, because they can be with the 6 feet of social distancing and the sanitizing. That just may not be a practical arrangement for that particular part of the coffee shop.
Okay, thanks. There is a question that I think I might be able to, or Chris might be able to answer in terms of maybe some state or county relief coming for cleaning and disinfecting supplies. Those are definitely new, probably new and greater charges than you're used to. And so the question is, will there be state or county tax subsidy relief coming for cleaning and disinfecting supplies? Now, it may not be a tax situation. However, there is one program that the governor mentioned yesterday in his press conference about authorizing the $2 million worth of PPE. That is PPE, but perhaps it could be cleaning supplies as well. I believe that that's handled by the Department of Homeland Security, the Office of Homeland Security, and they will be putting out a questionnaire about what types of supplies do businesses need to be able to comply with these. I think that's a real effort to help out in this time. The other thing that is coming down the pike is a portion of a bill that will be discussed in the session on tomorrow and Saturday regarding the reimbursement for COVID-related expenses, which I believe what you're talking about would qualify as well. But again, that bill has not been passed, and so we'll kind of stand and wait to see how that will be handled. Chris, anything to add there?
Yeah, Josh, you covered both of those nicely, but I would say that if that bill is passed through the legislature this weekend, we'll make sure to have that up on our website and have a blast email out. I think that component of the bill that you're talking about, where if it is passed in its current form, would allow businesses to be reimbursed for PPE up to $500,000. That's obviously a very valuable piece of legislation. And we are weighing in on that and monitoring that very closely, and we'll have any updated information out early next week on that.
Thanks, Chris. Okay, let's see here. Fast food. So Stephanie, here's one for fast food. It says is it suggested to stay drive only, as bussing tables is not a specific part to any one person?
So that's another good question. And I think the answer is somewhat similar to before, that this might be an individual business owner decision where typically you may not have a person who's designated as a busser because it's a fast food situation, but under the circumstances of the order, I think it would be something you may want to consider. Do we want to have one person or two people, for example, dedicated to bussing tables so that we can have our dine-in operation open and perhaps serve more customers by doing that? And so I would not go so far as to suggest that the business stay drive-through only. If it's possible to reallocate your staff and obviously maintain the 6 feet of social distancing. So I would, as a business owner, probably look at the options in that regard and see if I could have staff that would be specific to bussing tables.
Okay, good answer there. All right, so I think there is a little bit of confusion here. So this question comes in from Jessica. To be more clear, are employees required to wear face coverings?
Yes, they are. So if we refer to the order, the order that's coming out, and these are all available. Josh, are they available on your website as well as the governor's website and ours?
So we have a link to them on our website and a link at the end of this presentation, yes.
Okay, so these are available. So this is in paragraph 1F. The staff that come within 6 feet of customers or other staff shall wear face coverings. And that's in paragraph 1F. So yes, staff are required to wear face coverings if they're coming within 6 feet of customers or other staff.
Okay. The next question has to do with a cook that might also be a server. Do they need can they switch gloves before serving, et cetera? Can they do both of those tasks?
Yes, they can. So yes, if a cook needs to switch gloves before serving, that is completely fine.
Okay. So the order states, this is a good question from Josh. Josh asks, order states that we need to wait until the guest leaves to clear anything off the table. Can we pre-bus appetizer plates, drinks, etc., while the guests are still at the table?
So, I think that when we were talking through these and developing these orders, this may have been one area where we need to take a further look, because like I said, we don't want to have a situation that is just completely absurd. And so I think I'd like to do some further checking on this, and we can put this out in guidance. In terms of, can a server remove a few of the dishes from the table? So I'd like to put this out in further guidance, Josh. Once we're done, I can look into this more and just see, how far can we go? What is, too extreme, and what is just a matter of course that could easily be done by a server as they're helping their patrons that are in the restaurant. So we can follow up on that one. Okay,
good. Thank you. Here's a question that many of you might not be thinking about right now, but I think it could be pretty darn important. Is live music allowed in a bar, assuming that there's no dancing and all social distancing is followed?
Well, that's a great question. I think that's one I'd like to follow up on as well. I'm kind of thinking through that, as we're talking about the different activities that are going on, looking at the language and the order. Our order does say in 1U, no dart, pool leagues, dances, events, or karaoke. And so I know we're not talking about karaoke, but I'm just thinking of when we talk about events, how are we defining events? So I think I'd like to follow up on that and see specifically to that question, whether or not that is something that was contemplated there. As I said, we did not anticipate every single scenario or situation that could be, that could be covered. So I'd like to follow up on that.
No worries. Okay, here are a couple, these are kind of process questions. And so we talked a little bit about what the tracking was for customers, for patrons, whether there was any need to do that. But is there a standard form the health department wants to use for tracking employee temperatures and health? And I don't know about record keeping. I know there are some guidelines on your website, right?
Right.
And then the other part of this question has to do with, is there a process or best practice if a restaurant employee is confirmed with COVID?
Sure. So we do have a screening tool up on our website, and I can go ahead and paste this into the chat. This is probably dangerous for me to try to multitask right now. Let's see,
Stephanie, we can find that and do that. I think Warren and Ben on my side could definitely find that and paste that into the chat so everybody has that.
I just pasted it in there.
Oh, okay, perfect.
So yeah, so if you do find a situation where you have an employee who seems to be symptomatic for COVID-19, they should immediately be sent home. If they're in some type of medical distress, which I'm hoping that they wouldn't be at work under those circumstances, they need to call their healthcare provider right away. And a lot of times, you hear people giving the advice of calling your healthcare provider right away. And the reason for that is if the healthcare provider does suspect that the individual is COVID-19 positive, they'll want that individual to take some precautions before they just walk into the clinic. So it's really important, if people do believe that they are symptomatic, that they call their healthcare provider right away. And so that's what employers should do if they find themselves in the unfortunate situation of an employee coming to work, with COVID-19 symptoms. They should immediately have them leave the business and call their healthcare provider.
Okay. Here's a question about variances and exceptions and the state orders. We talked a little bit about this superseding the variances that are out there unless they're more restrictive in a couple counties. But what is the difference between a variance and an exception?
That's a good question. So a variance is something that a county would seek on behalf of all of a certain type of entities in their county. That's a variance from the statewide order itself. And so that is what we saw a lot of in terms of the variances that counties sought last week, is they wanted a variance so that all of their restaurants could operate in this manner, and it was spelled out. An exception is a situation where perhaps you have a school that wants to hold a graduation. And we know that when these new orders take effect, the limit for gatherings is 25 people. And so, maybe you'll see a school that says, we have a small number of graduates and we would like to, have them gather in this manner, for example. And so that one activity would be an exception based on the protocols that they've put forward and how they plan to achieve social distancing, how they plan to conduct the event, if it's perhaps more than 25 people. So the exception is more kind of a one-time or limited basis, whereas the countywide variance covers all types of certain businesses in the county as a whole. I know it can be confusing, and that's a really good question.
Yep. We've had this question a couple times. Can the same employee handle money and food or drinks?
So, and this, I believe this is in our order, and I need to see if I can quickly find it, because I do believe we have talked about that. And what I am not remembering right off the top of my head is whether that was taken out, because I know it's been in prior orders. So I'm just going to quickly look through this and see. Let me follow up on that one, because I'm not seeing it in here, and I just want to make sure I'm not missing it here while we're going through this.
Okay, and while we're looking at that, this one might be an easier one. So there's a portion about condiments in the orders. Does that include prepackaged condiments?
No, it does not.
Okay. All right. Let's see. Let's jump in here. A couple questions more about masks. If staff are not going to be within 6 feet of customers, let's say they're in the kitchen or dish pit, are they still required to wear masks?
Okay, so that one, that's covered under our order under 1F. And that one does state that if staff shall come within 6 feet of customers or other staff, then they shall wear face covering. So if they are in a position where they're not within 6 feet of customers or other staff, then they would not need to wear that face covering at that time. But when they will be within 6 feet, they should put the face covering on.
Okay. And then I did have another question about face shields versus a face mask. Is it possible that people could wear a face shield rather than a mask?
When we talk about face coverings, I think we're talking about anything that falls into that category. Different types of face coverings, and I think we're just trying to use that term broadly.
Okay, all right. If an employee or customer is confirmed positive, is the business required to close down?
So I think this will depend a lot on the circumstances, and our contact tracing will give us more information about that. There are different cleaning protocols available on the CDC's website, but I think we would really need to know more about the particular situation. So it's hard to answer that one generally. I think it would really depend on, where the employee was, who the employee was in contact with, et cetera. And so I think we'd need to, evaluate that situation kind of on a case-by-case basis.
Okay. And then what are the steps? And you touched on this a bit, but what are the steps in case there's a confirmed case in-house?
So so basically, it starts with the employee working with their healthcare provider. That individual tests positive, And that's when the contact tracing starts. So we have our team of epidemiologists and some local community staff who start reaching out to first the confirmed positive, talking through, with that individual, where they were, who they came into contact with, when that contact was, greater than 10 minutes and within 6 feet of space. And then as they get that information, then the epidemiologists reach out to the individuals that are determined to be close contacts. We've had a lot of situations where people are, they hear of someone who has tested positive for COVID-19, and, as they go through their list of close contacts, we may have someone who doesn't fit into that category or criteria, but maybe someone thinks that they actually are. And so, our epidemiologists are well trained in terms of looking through that and identifying who actually is a close contact, because not everyone is. If they maybe just passed by that person for a brief second or two, they're not going to be deemed a close contact. And so, the individual will have, that list of people. Our epidemiologists will contact them and then decide, act accordingly in terms of what precautions they should take based on the circumstances. So it's a very involved process. We have a great team of epidemiologists who are doing this really all day, every day. And it's a very important component of making sure we have a good handle on this disease.
Yep. Here's a question about hotels. Are we able to hold meetings and events where we're able to respect social distancing regulations and not providing food and beverages, speaking from a hotel aspect where event space is available and clients need to hold meetings?
So, the issue here comes down to the interpretation of what is a confined space. And so, of course, as we're aware, order number 2 limits gatherings, the one that will be coming into effect. It prohibits gatherings of more than 25 people in a confined space. So, how do we define that? What is confined? What is open? And so if the meeting is, going to have 300 people, that is not something that I think would fall under that order right now. I think if a person has specific questions, it's important to reach out to the county health officer to say, this is what we're intending to do. This is, the event that we're thinking of. Would the event, if structured in this particular manner, fall within the guidelines that are covered in each of the orders? And I think really talking through that, calling the county health officer, calling the local public health nursing office to kind of talk through some of those specifics is the best way to handle it. But keeping in mind that typically we're talking about a confined space and limiting the gathering to 25 people or less.
Okay. And here's a question about maybe the payment register with the, and face masks again. If there's a plexiglass barrier between the customer and the payment register, is a mask required?
So, again, going back to the language in the order, what it plainly states is that staff who come within 6 feet shall wear a face covering. But again, where I talked about we didn't contemplate every single situation, I'd like to do some follow-up on that as well. And of course we didn't specify barrier, we did specify face covering. So let me do some follow-up on that, and then we can get the answer back out to everyone, okay?
Stephanie, you're doing a fantastic job. There are a few more questions. And Chris does have a question. He's known to throw a curveball or two though. So Stephanie, be watching for that hanging curve.
No, Stephanie, I think you addressed this earlier, but we've gone over so much. I just want to double check because I've gotten this one a lot. Are restaurants and bars allowed to have folks sitting at the bar? Can they have, a couple sitting and then 6 feet down, 2 more bar stools, etc.? Pardon me if you've already answered this.
That's okay. There's a lot to take in here, so I know it can get confusing. And even as we look through these, there's a lot to interpret. So if a person is sitting at a bar and it's, one person or a household, that group would need to be 6 feet from the next party that's at the bar. So I think that would be permitted as long as they're 6 feet. We did talk through this some as we were drafting these orders and talking through them. And, you know, the question was, what would the difference of that be between 6 feet between tables? And, you know, we talked that through and determined that people could be 6 feet apart at the bar.
Great. Thank you so much.
You're welcome.
Stephanie, here's a question about refills. Is it possible to pour refills from like a wait staff pouring it from a coffee pot or a water pitcher into cups that are already on the table? Is that permitted?
You know, I think that it would be. I don't, but I'd like to look into that more, because I know our specific language says drink refills. You know, actually, Josh, maybe not, because drink refills are not allowed in the same containers. So I think the plain reading of that might indicate that that's not permitted, which would necessitate a new cup or glass each time. Right. So that one may not be permitted, but I can certainly follow up on that.
Yeah, we might want to follow up on it, because I'm guessing that refills probably meant a refill station where an individual is bringing their cup that could, potentially spread from that. Whereas this might be, has to do with the contact of the two vessels, for example, right? And so that one, I get it. That one is definitely an interesting one. So yeah, thank you for.
It sure is. And, I think the concern there being if there is inadvertent touching of the pot to the cup, and then that is used to refill the next patron's cup, I think that would be the concern right there. But I can definitely follow up on that one and see, what the interpretation is and, where we're at with that one.
There was a question that came here. I don't want to miss this one. I think this is a question about drinks that are being mixed for the dining room at a bar where people are also sat to eat, right? So imagine a bar area, somebody's mixing drinks. Does the drink prep area need to be 6 feet away from the nearest guest?
So, I think this would be a situation where we would think about practicality. And so when guests are being served, their server is obviously coming within 6 feet of them. So I think under the circumstances presented in that question, if the individual preparing the drinks wears a face covering, that activity could still be happening, because it's sort of just the practicality of being in a place. And so the face covering is what would be needed there, because they would be within 6 feet of the patrons.
Yep. Okay. One more question, Stephanie, I think, and then we'll be able to wrap it up. Let's see. So if a restaurant does takeout only, does the person handling the food container have to have a mask and gloves on?
So if that person is coming within 6 feet of the person that they're serving, then they should be wearing a face covering.
Okay. All right. Well, I think with that, Stephanie, you did a fantastic job of answering these. I think we all can understand that this is it's a complex time. There are a lot of scenarios that cannot be addressed and with the guidance. I do believe, Stephanie, you mentioned this earlier, but to talk through with your county health officer, if you do have questions, I think they're a great resource to double check and make sure. And I think also, as Chris mentioned, reaching out to Chris and his organization to see if there are things he can do to help is also really important. I think that connection with Chris, as well as the Business Council, because as we continue to hopefully, and again, in a data-driven way, hopefully continue to relax these orders, we want to be able to know the situation so that we can plan for those. And I think providing a mechanism for feedback. You can see on your screen now, there's a way to contact us at the Business Council to ask your questions, and there are more resources there available. But I think this is a time when we're going to uncover some interesting situations. We're going to uncover some of those things that we did not intend, or consequences that come up. And we just want to make sure that we kind of keep that open dialogue and working toward the same thing, which is ultimately the public health issues, as well as the economic viability of our businesses. And ultimately, it comes down to taking care of our customers. And as restaurants and bars, you know that that's your lifeblood is taking care of your customers and doing it in a way that helps them feel comfortable. And I think Chris's words about making us the shining star and the best example of how to treat and to run hospitality organizations is really a key, because we are very heavily reliant on tourism, and our restaurants and bars are a key component of that. I really appreciate everyone's time today. We had a great number of people attending. Please don't hesitate to reach out and ask more questions. And with that, I'll turn it over to Chris and Stephanie for any final words.
I would just say thank you very much to both of you, and thank you to everybody that participated. Certainly there's going to be a lot more questions, and so you're welcome to send those to me. I'm happy to reach out to Stephanie and Josh as well, but I would also underscore that your local county health officer really is a great resource. If it's a relationship that you don't already have built strongly, this is a great way to start building that. Reach out to them with these questions, be in close contact with them. Again, we want to knock this out of the park and do it right, and they're the person locally that you can really work with to make sure that you're ensuring safety, and most importantly, building confidence with your staff and with your customers.
I agree, and Josh and Chris, thank you both for your efforts in this regard, and we are really standing ready to help and do whatever we can to advance and protect public health, and also think of the economic health of our communities as well. So thanks to everyone.
Thanks, everybody.
All right. Goodbye. Have a good afternoon. Thanks. Bye-bye.